Please welcome to the stage Dr. Brendan Carr of Mount Sinai Health System, Dr. Biraj Kamaracharya of the Dulikhel Hospital, and Dr. Rachel Freeman of the Icahn School of Medicine at Mount Sinai.
Good morning, everybody. It's great to see you. It's great to be back at Concordia. And my name's Brendan Carr. I'm the CEO of the Mount Sinai Health System. And it's incredibly fun to be here. It's incredibly fun to share a wonderful story with you about a partnership that we have with some dear friends and some trusted colleagues in Nepal. I want to take one moment before doing intros just to sort of say something about Mount Sinai. We're a massive health system in Manhattan, but we were born out of a community need, out of a need for service to patients that didn't have access to health care. They built a hospital that then converted or created a medical school so that they could explore the very best research and educate the next generation about how to take care of folks. And I bring that up because it lives on today as we talk about this partnership. So I want to say that it's a great pleasure to be with Biraj and to be with Rachel, trusted friends and real leaders in their fields. You know, I know that you have notes on them, but Biraj is the Chief Administrative Officer for the School of Medicine at Kathmandu University. And he's also the Administrative Director of the hospital at Dulikhel Hospital, our hospital partnership. And it's a really special thing to have both of those things, to be growing the next generation at the same time that you're really running administratively the hospital. It's critical to acknowledge a very special person sitting in the audience here. Dr. Ram founded this thing 30 years ago, and although he's like a proud father, I'm sure, watching as it happens every day, he's handed over some of the day-to-day administrative responsibilities. He is a massive personality that has driven this to be a success. And then Rachel Freeman is my good friend and colleague who runs our Department of Global Health at Mount Sinai, but also the Arnold Institute for Global Health at Mount Sinai. And there's folks from both teams, from the Mount Sinai team and from the Dulikhel and the Kathmandu University team here, and it's a great privilege to have them here. Last year we did a panel where we talked about a partnership with a different country, and it had a different character to it, with some common themes around service to community and partnership across an academic medical center and a health system. And you're going to hear some of those themes today. This partnership in Nepal has been going on for several years, is going really, really strong, and has some really key components that I'm going to ask in just a minute Rachel and Biraj to dig into about how it's special and why it's special. But before I go there, I just wanted to say that I had the great privilege of visiting this hospital in the Kathmandu University School of Medicine for graduation just a couple months ago. And it's just near impossible to really understand the scope of what has been done unless you're there, really soaking it in and appreciating, one, the varied terrain and the incredible catchment area and responsibility that they have. It's just a massive catchment area of folks that they're trying to serve. And then two, the scope of what they do. So the scope of what they do is everything from public health screening for breast and cervical cancer in very small villages and very remote areas, to small outposts that have a doc and lab and some imaging and some ability to really stabilize and take care of people and get them early diagnostics and interventions, all the way through to really specialty referral care, critical care. I literally walked into a meeting and on the Zoom screen was a neurointensivist who, the last time I saw him, I was standing on the Upper East Side, and I got called by the CAT scan tech who said, "You better come look at this." Right? And I ran over to the CAT scan tech to look at the image as the patient was coming off the table, and the neurocritical care doc arrived at my shoulder before I called him, saying, yeah, they called me too. We got to take care of this guy. Right? So he's on the Zoom screen because he's got a partnership with this hospital in the middle of Kathmandu. It's really a magical, special thing that these individuals drive these partnerships. So enough from me. The only thing I really want you to remember from me is that the individuals are critical, and that I'm fortunate enough to be able to have a conversation for a few minutes with these folks. So I will start by saying, I'll start with Rachel, but by asking you to talk about the partnership, because global health does not come in one flavor. It is different, and there are some very specific components about the way that you think about global health, and specifically the partnership with Dulikil that I would love it if you would talk about.
Sure. So very often in global health, whether you're thinking about how medical schools and hospital systems like ours engage in global health, or NGOs and other work, we often see things where there are a lot of projects. There might be a grant to do a particular thing. There's a certain effort. And certainly the work that we do in partnership in Nepal includes lots of projects and people and grants. But when we form our global health relationships and partners, we're really talking about something different. We've built our model around having institutional partnerships that are long-term, that are sustainable, that have mutual benefits on both sides, where we're really trying to bring the very best in clinical care practices to together innovate and generate some of the best science, to together educate on both sides of our partnership the next generation of healthcare leaders, and to do that over the long term. So we unite an academic institution, typically, their health system that's facing and serving the public, all the way from small, tiny clinics up to the specialty national hospitals that provide the highest level of care, as well as working closely with their governments, the Ministry of Health often, or government partners in a place. I'll tell you an example from my own history in global health of why I think this is so significant. Essentially, I truly believe that this kind of partnership can work miracles in a way, that it can solve really big problems. And the reason I believe that so firmly is that when I started working in global health in the early 2000s, I was in Kenya working in a partnership structured like this one, in fact, which Mount Sinai is still a part of, with a medical school in Kenya, their large health system, and the Kenya Ministry of Health. And at that time in the early 2000s, our wards were full of patients dying of HIV. I'm a pediatrician, as you know, and even on the pediatrics ward, the wards were full of kids dying from HIV that they had been born with. There were very few medicines available in the country. And this partnership, these big institutional partners, were positioned and were in relationship already and ready to receive one of those first grants, actually, that came at that time from the US government, one of the PEPFAR grants, to start to respond to the HIV epidemic. And why it was so critical that this partnership was there was that we were really able to bring in the very best of the clinicians, of the nurses, of the workforce from Kenya, with experts that were needed from not only the US, but whoever might be needed for technical assistance. Right. We had the government partnership to work with the Ministry of Health to start to grow up a care system at Ministry of Health locations to be able to respond, and to make the kinds of relationships with the government that we needed for getting medicines, for supply chain, for the digital systems, for all of that. Fast forward now 20 years, not only did we build an HIV care system that still provides care for over 200,000 people in Western Kenya, but on that framework of that health system, we are able to build a healthcare system that provides chronic disease care, that provides preventive services, that's really changed the health of the population there for an area that serves about 20 million patients. And a big part of what an academic medical center, a medical school like Mount Sinai, like Moi University in Kenya, like Kathmandu University in Dulikil, like we're going to talk about, is we can really bring the best of science, the best of innovation, the best of clinical practice together in our partnership and address these really big problems that communities absolutely need us to solve, whether in Nepal, in New York, in Kenya. We're learning together, but also innovating together, and then making those changes even across an entire country.
The bidirectional flow, resonates deeply. And the other thing that I hear and that I felt when I was visiting is how attentive the listening is. How focused the agenda is on the issues that are most pertinent to the folks that are actually trying to solve them. You've been trying to solve them for decades at this point, right? You know, you're sort of, you know, your origin story is in grabbing communities and empowering communities, and then I guess I would say, as an external observer, the superpower is that you got deeply connected into a powerhouse hospital, powerhouse university, school of medicine, and now you're in this role trying to build an even bigger bridge with an enormous network of folks, you know, starting with and partnering with our academic medical center, but much bigger than that. I guess, you know, for me, given your experience, this model, the model of that Rachel's talking about, does it feel different? Does it feel the same? Is it easier, harder, better, worse?
Yeah. Let me, you know, take a step back on this context. We talk about innovation in health, and when we talk about innovation, generally the thing that strikes in our mind is related to technology. You know, we think about new things, you know, new devices, new apps, and so on. And but what we really want to experiment, and what we are really pursuing in this collaboration, is the innovation in terms of the approaches of partnerships. And this is very new to us. And we have been always, you know, realizing that there are tremendous needs in different parts of the world, and not just the need, but there's also tremendous resources, you know, in every aspect. It doesn't need to be financial resources, resources in terms of expertise, resources in terms of networks, you know, connections, but somehow we haven't yet figured out in global health, how do we best do that? There's so much of goodness all around, and we haven't figured out a way to harness that. And that's a little sad. And I tend to think, when we talk so much about artificial intelligence, that a lot of sufferings in the world currently is not due to the lack of artificial intelligence, but maybe due to the lack of, you know, the use of natural intelligence we have. And what we are seeing in this partnership is trying to figure out these new modalities of partnership in which we bring together communities, health providers, academia, research, industries, and many other stakeholders. And we are trying to, you know, figure out if we can create a model, a successful model, that not only proves successful in the context of Nepal, but if it can serve, you know, as a model for the rest of the world. So that is what excites us most about this partnership. And I want to echo what Rachel mentioned. A lot of things, you know, we are co-designing. We are co-designing our partnership. We are co-designing our priorities, and all the times things don't go right. So when things go wrong, we get back to the drawing board and then start fresh. And we are finding lots of new possibilities, opening up new vistas of collaboration. Just to mention, you know, lately we've been collaborating a lot with our Kenyan friends, sending our trainees and faculty and researchers to Kenya and vice versa. And we are figuring out, wow, you know, we have never done this before. They had never done this before, and what a tremendous amount of potential that holds. So in summary, I would like to say that this is a very different partnership. It is not just a partnership based upon an established model, but it is actually a pursuit of creating a new model that will serve as an example for the rest of the world.
Maybe just to add one point on that, you know, I think it's critical, as Biraj is saying, you know, when you have a partnership that's not dependent on, you know, oh, just these two people who liked each other and wanted to collaborate, or this one grant, we can walk together through all kinds of big challenges, whether it's conflicts, whether it's natural disasters, whether it's changes in administrative policies. We can continue to move forward because it's not our partnership and the work that we're doing together for improving the health system, for learning together. It's not dependent on just those, you know, that one person or that one grant in that way. So it's a lot more sustainable in that way as well.
And I'm going to guess that the audience sort of knows that that is a thing that happens, that you get a grant or you get a project that someone's deeply interested in, and then when that's done, you know, things fade away. And this is, I mean, I hear you loud and clear saying this is not and I felt it, it's not transactional. It is a long-standing relationship. It's a deep commitment to trust and communication, because you don't know what the next thing that you're going to have to solve for is. And so I guess I would say, you know, my next question was really about what people need to hear in order to scale and adopt this sort of way of thinking. I think we heard a lot of it, but if you want to foot stomp any of it or revisit any of it, it does strike me that those core foundational principles of we're not solving a single problem, we're creating a relationship so we can solve all the problems is a central theme, but I'm going to make sure that I give you a chance to talk about that.
I might say two critical pieces from my end. One, I think, is, as Dr. Barrage mentioned, listening to the community and starting from local priorities as the absolutely first thing that you're doing. You know, one of the things we're really trying to address in Nepal are chronic diseases and what it looks like to screen for them, to prevent them, to treat them. And the only way that that can really be done is in a specific place, not only going to the community, but listening to the community and shaping what's done around that. I think the other thing is this key part about building trust and building relationships, that it can't be, you know, us just dropping in with an idea or a certain, you know, flashy thing we think is going to be the new answer, but that we really need to live out our commitment that we're in this together for the long term and that we have this shared priority for improving care for people, whether in Nepal or in New York, as we said. What about you?
Raj, other pieces that, you know, are take-homes for people that are trying to learn from or to scale?
Yeah, two things I would like to emphasize. The first one is don't settle with the conventional wisdom. And what I mean by that is, you know, and I don't need to repeat it, a lot of global health collaborations are very much activity and project-based, and not so much of efforts go in terms of institutionalizing those partnerships. I think that has to be the focus, and I think that has to be the big paradigm shift in our global health partnerships. And then the second is don't you know, dare to take up some bold challenges and not just you know, look up to the low-hanging fruits. And I think that is also very important, you know, in not just our partnership but also other partnerships, because you know, I like this quote of Robert F. Kennedy that there are those who look at things as they are and ask why, and I dream of things that never were and ask why not.
Yeah.
So we have to be able to ask, like, why not? Why can't we provide this, you know, breast cancer or cervical cancer screening for all women? Why can't we provide chemotherapy for, you know, all cancer patients, even in low-income settings? Why can't we provide timely stroke or MI care for patients even in resource-limited settings like Nepal? And the institution, Dhuli Khel Hospital, has been onto that since the very beginning. And we have proved, you know, in the last 30 years that it is possible. But the partnerships are necessary to sustain these efforts. So I think these are the two essential elements I would emphasize.
Can I just tell you, I mean, sort of like that optimism and that we will not be defeated mindset is amazing to sit next to and to hear, and I feel it all over again from walking around with these guys, right? I'm looking at Dr. Ram, Rajiv, I'm looking at Archana, and I'm thinking about the way that she felt when we were walking through small communities where they were doing breast and cervical cancer screening, and I was asking culturally, how does that work, right? Like, you know, is it okay to talk about these things? And, you know, just sort of the smile of like, well, it turns out it's quite hard, you know, and that only came because the questions and the answers about how to do it came from the community, but it only got implemented because people think the way that you all think, which is to say, we're going to do it. It's too important not to do it. Well, so, you know, my question was about how you export and what the lessons learned are, and what you said was just, you know, decide never to surrender and just to keep going. Yeah, okay, that's a big hill to climb for some folks. You know, I watched. I mean, obviously, right? I'd been with you all. We spent a bunch of time. It was wonderful. And one of the things we talked about was your adolescent programming. And then I watched the news a couple weeks ago. Really, really, really worried about all of you and worried about, you know, this country that I'd come to understand just an itty little bit. And I reached out to check in because the youth protests were you know, at least from a distance, were unsettling and were scary, and I didn't know what to make of them. And I guess I'd love it if you'd take a minute to talk with us about the country, the youth programming, the engagement of youth, the future of the country, since we're dependent upon them. I'll share that we both had kids that are just graduated from high school and we're going to college. We're talking about that. And then I'm watching this happen and I'm thinking about the conversations we'd had about out-migration. We're thinking about what we do to make sure that this generation, we're like, 2 steps away from them taking care of us when we get ill. And we want to make sure that we get that right.
Yeah, I'm a father of a 19-year-old. And what happened just 2 weeks back in Nepal, it shocked us all. We're still trying to comprehend. But one thing for sure to all of us was that it was a wake-up call to see, recognize, and and acknowledge this large portion of our population who are youth. Almost 45% of our population, they belong to these young groups. And we realize that this is a population that has been sort of missed in a lot of different policies, programs, and priorities. And I think it was to one of my colleagues from Mount Sinai, I was telling just a few weeks back that we were proud, we have always been proud of starting some of the first and pioneering youth health programs in Nepal with Mount Sinai, which is a big strength from their side. But it was 2 weeks back that I really felt how tremendously fortunate we are and proud to have started this new initiative in youth health, which which will need to be expanded tremendously in coming years in Nepal. And these are the scenario in global health priorities. There'll be lots of changes. There are lots of new things that will come up. But I think the ability to adopt to these new priorities and work together and chart new course is the core strength. I think that what we seek in this partnership. And for now, we are incredibly proud of what we have been doing in youth health.
Yeah. Did you want to add something?
Well, as a pediatrician in the group, I always want to talk about youth health, but I think both of you had. But it is really, it has been actually a core part of the work that we've been doing in our partnerships in Nepal, as well as in Kenya and Guyana and elsewhere. And I think so often the needs of youth and the health needs of youth really are missed. They're missed in our health systems, where we focus a lot on the things that babies need early on and shots and things, and then often there's not a place in health systems for youth to receive mental health care or get even very basic vaccines or health exams or other kinds of supports that they might need to stay healthy and stay strong and stay in school. And I think it is this critical opportunity when we keep youth healthy. They do have the ability to stay in school. Interestingly, there's a brand new study that came out looking at the combined data from over 2 million adolescents going into adulthood over the years. And it really shows that the health problems of adolescents absolutely get carried into adulthood and shape adult health problems, whether that's chronic diseases like diabetes and heart disease and obesity, whether it's mental health issues with substance use, the challenges that come when pregnancies happen really early. And if we can shape the opportunities for youth to really stay on that path of resilience, of having a sense that they have a positive future, of seeing opportunities in their countries that can really let them grow, like that's when the youth, we can be so excited about what the youth are going to hold for us, not scared of youth or scared of the teenagers in our homes or in our countries in these ways, the way I think sometimes we are. But really the youth health is the health and the wealth of the country. Like that really is what's going to shape the country moving forward.
For those of you in healthcare, you'll know that sometimes the cardiac surgeons and the cancer doctors scream louder than the pediatricians, but it's worth taking a beat just to recognize that Rachel is speaking the truth there, and we're guilty as charged, right? Healthcare in the U.S. has always been a little bit more reactive than we want it to be. There's a massive pivot in the U.S. and globally around actually trying to build health rather than to treating disease, and I would never try to say it any more effectively than you just said it. Just a minute left. I would say that let's end on, if it's possible, your favorite accomplishment, component of something that has come from the partnership. There's got to be one thing that when you sort of put your head on your pillow at night, feels like, yeah, we did that one right. That feels good. Is there a clear one for either of you? I mean, other than getting to meet each other and creating an amazing community.
For me, it's in terms of the major accomplishment. I wouldn't say that our major accomplishment is the thousands of women we screen for cancer, or the dozens of trainees we provide opportunities, or the dozens of other research opportunities we create. I think the major accomplishment is to create a proof of concept that this type of partnership that brings in the good of all different stakeholders can survive and can be replicated in other settings. I would consider that as the major accomplishment. And then the second is the realization of the fact that that what should be most bothering to us is not the magnitude of the challenges we face, but rather the ignorance of the opportunities we have. So I think these are the two major accomplishments I would consider.
That's a pretty good one.
I love both of those. I mean, I love the ways that together we get to build innovative learning health systems that really start to provide not only better health for all, but show us how to do that no matter where we are. I have to think about the ways in which some of our combined teams found ways to best support pregnant women in Nepal with community health workers and a whole curriculum and supports around that. And that's something that we directly have taken back to Queens, New York here, where women in Queens with our faculty and partners in the system are now, well, they're pregnant, having doulas that support them in the community, that are often from their communities, that are from their ethnic backgrounds, that speak their language, that provide that same kind of support through pregnancy and for women and their babies afterwards, that really we learned from doing that successfully in Nepal and starting to see that scale up and even become the Nepal government's model for how to support pregnant women. So I love how we learn from each other and our health systems improve out of that shared learning.
Yeah, one more time again on the bidirectional, and just to sort of emphasize that I know that you're talking about the diaspora from Nepal that happens to be large in Queens, but even beyond that, you're talking about other cultures now sort of loving this model of having sort of doula and home-based care.
Absolutely.
Well, we're at time, and I just want to say one more time to the amazing partners from Nepal, thank you. And I want to also say for the amazing Icahn School of Medicine team that Rachel leads, and there's incredibly dedicated people sitting right here that spend most of their life living in Kathmandu as a part of Mount Sinai, and I want to thank you for that especially. Thank you everybody for being here today. Thanks for listening. Thanks for the opportunity to talk about our great adventure.